Good afternoon. It's another glorious day at Bergen Newbridge Medical Center and the perfect backdrop for today's community grant announcement. I'm Donna-Lee Carreri, the Medical Center's Chief Communications and Marketing Officer. Before we begin today's program, please join Commissioner Amoroso as she leads us in the Pledge of Allegiance.
Thank you. Please join me in honoring America. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner. I would like to welcome Congressman Josh Gottheimer and his team, County Executive James Tedesco, Commissioners Tom Sullivan and Mary Amoroso, members of our medical staff family, our colleagues, our hospital board chair, Julia Orlando, and all of our guests, and especially our President and CEO, Deborah Visconti, who will share with you some of the details of the project this federal investment will help us fund, our emergency room expansion project.
Thank you, Donna-Lee. What a great, glorious day here at Bergen Newbridge Medical Center. And what an exciting moment for Bergen Newbridge Medical Center as we announce today the $2 million federal investment we are receiving with help and support from Congressman Josh Gottheimer. This grant is significant for the communities we serve as it helps us embark upon the next stage of our renaissance, our emergency room expansion project. Our new emergency room will better support the diverse needs of our communities and give our staff, some of whom have joined us today, thank you all for being here, the cutting-edge environment, technology, and resources to better perform the life-saving work they do every day. There are no words to thank Congressman Gottheimer enough for his tireless efforts to help secure this community grant on behalf of Bergen Newbridge Medical Center, our staff, and most importantly, all those who seek our care. This essential enhancement will expand our current footprint of 19 emergency room beds to 49 total beds. 19 medical beds will be dedicated to patients receiving acute care. The remaining 30 beds are dedicated to behavioral health and substance use disorder patients requiring non-acute care. We have seen a sustained increase in the need for mental health emergency services from all ages, ranging from pediatric to geriatric. Our emergency room is the hub for such emergencies, and we never divert any patient seeking our care. Not through the pandemic, not today, not ever. A resource for all residents, the renovated emergency room will be better equipped to treat the needs, both mental health and medical, of our county's vulnerable and underserved populations. Indeed, this renovation is at the center of the medical center's equity plan to provide access to care for communities disproportionately affected with higher rates of chronic illness, comorbidities, substance use, and mental health needs. This project is essential for the medical center to fulfill its mission and commitment as a safety net facility, providing for the health and well-being of our diverse communities. A feature that will be unique to our new emergency department will be the living room concept, which embraces the recovery model and offers people experiencing mental health crises a calm and less intimidating and more therapeutic environment. In response to the children and adolescent mental health care crisis and understanding the unique needs of children and their families, our emergency department will have a separate pediatric area to reduce the additional anxiety of a traditional emergency room visit for children, adolescents, and their families. We are creating a separate geriatric pod for our elderly population that's unique to their specific needs. The ED expansion project will include 30,000 square feet of construction and renovations, and the expansion will create over 50 new jobs of clinical personnel. The proposed program for the first floor includes a behavioral health department, behavioral health emergency room departments, and all kinds of support space for our staff to be able to do the life-saving work that they do every day. This project will also fuel the modernization and expansion of the existing ICU and acute care units to support the increased ED patient flow by adding or updating to our existing facilities. So this is only just the beginning. Once again, we thank Congressman Gottheimer for his support and the role he played in helping secure funding for this renovation. And of course, the power of partnerships is something I often speak of. Together, we make real, meaningful, and life-changing differences. I'd also like to thank our county executive, our county commissioners for their continued support as we continue to grow, innovate, and care for our neighbors. Thank you.
It's always a tough act to follow, Deb. It's always a tough act. Deb, thank you for your leadership, and thank you for getting us to this moment in this amazing day. Thank you. Indeed, it is about partnerships, and we do enjoy the unwavering support of our county commissioners. Speaking on their behalf today is Commissioner Tom Sullivan.
Thank you, everyone. Welcome. On behalf of the commissioners, we are so proud to have elected officials like our county executive, Jim Tedesco, and our Congressman, Josh Gottheimer. Debbie said it best when it comes to partnerships, because these two elected officials get it done. And our Congressman continually goes to Washington and fights for the needs of everyone in his community, and it does everything great for our county. Without their help, this project may not have happened. But the $2 million that Congressman Gottheimer has clawed back for the mental health emergency facility, it will do wonders for the residents of Bergen County and the state of New Jersey. This is a very special place here. The county executive, when I first decided to run for office, his one question is, are you all in at the time on Bergen Regional? Now it's Newbridge. And I was all in. And this is what we get when you put two wonderful elected officials together, like our Congressman Gottheimer and our County Executive Tedesco. This is what we get. Facilities for our people that have been affected by COVID, people that have been affected by mental health, and it is definitely on the forefront for both of these individuals, and without them, I don't know where we'd be. So on behalf of Bergen County Commissioners, I want to extremely thank our Congressman for never wavering and going to Washington in a tough environment and continually clawing back money for the residents of District 5, and our county executive who had the foresight to not close this hospital, but to keep it going for the betterment of everyone in Bergen County. So to both of you, I want to say thank you.
Thank you.
Thank you, Commissioner. It is always my pleasure and honor and privilege to introduce someone who continues to be so instrumental to the growth of our medical center and the strength of our county altogether. It gives me great pleasure to introduce to you our County Executive, James J. Tedesco III.
Good afternoon. You know, as I stand here, what I've heard is this is what good government does. This is what government's supposed to do. Good government helps people. And today, we're here to thank someone, Congressman Josh Gottheimer, for helping us be able to treat many more people that have mental health issues or crisis, and do it in a setting that allows them to feel secure, comfortable, but most of all, get the services they need. So that's what this is about, good government. And I'm happy to be able to stand here and say that in 2014, when I ran for county executive, securing the future for this facility was my top issue. For my campaign platform, For if I didn't win, this hospital would not be the hospital it is today. It may not even be a hospital. But understanding the role that this hospital plays in providing...
Pause and give Jimmy a round of applause.
But understanding the role that this hospital plays in providing a crucial safety net care for our most vulnerable residents, especially those in need of behavioral health services, substance abuse treatment, and long-term care, I knew it was the right decision to keep the hospital, and today is confirmation that that choice was the right choice. After mismanaged as a facility was in 2014, I believe that with some love, care, and the right leadership, not only standing next to me, the CEO and president, but all of you, all of the staff here, you are the heroes. You are the ones that are making this the wonderful place that it is. The future of our county's public hospital could not be brighter, and that gloomy decade is over. Once I was elected, my administration was able to begin putting the pieces in place to transition our county hospital away from the previous ownership group. In October of 2017, a monumental day in the history of Bergen County, the county announced the selection of a new hospital operator, Care Plus Bergen, and a new nonprofit formed by an alliance between Care Plus New Jersey, Integrity House, and Rutgers Medical School. After an extensive search for the right person to lead this new and uncharted mission at Bergen Newbridge Medical Center, we hired the dynamic and compassionate Deb Fisconi as the CEO. Under Deb's leadership, in 5 years, Bergen Newbridge Hospital has transformed into a major county asset and a respected medical center. One of the things that I've used over the last few weeks is this hospital was in ashes, and today the phoenix has risen, and the phoenix will continue to rise. And yes, there is the storied history where the phoenix does reburn, but I will tell you that we will be prepared to make sure that that doesn't happen.
Or a firefighter, too.
Yeah, that's it. So I'm able to do it two ways.
Exactly.
Bergen Newbridge Medical Center is in the middle of the most significant hospital transformation in the entire nation. Together, we have expanded access for veterans and launched inclusionary community health models for the Korean, Muslim, and LGBTQ plus communities. Just in the last year, Bergen Newbridge was named a top hospital by New Jersey's Best Magazine, attained an A rating from the hospital for hospital safety by the Leapfrog Group, and all of you know what the Leapfrog Group is, and earned a spot on Newsweek's Best Nursing Homes list. This all comes in addition to the national attention Bergen Newbridge Medical Center and the county garnered for our robust COVID response. The future has never been brighter for Bergen County's public hospital, the largest hospital in the state of New Jersey and the fourth largest publicly owned hospital in the nation. Today, we are thrilled to announce a major $2 million investment in the community project funding from our federal government, which will help Bergen Newbridge to continue its momentum. The grant would not be possible without the efforts of Bergen County's great congressman, Josh Gottheimer, who was instrumental in securing this funding. Thanks to Josh's effort, This funding will cover a large portion of Bergen Newbridge's Medical Center Behavioral Health Emergency Department expansion project. These monies will help support the continued growth and advances that have been made in the last 5 years, and we look forward to serving our residents for decades to come. Ladies and gentlemen, it takes a team. It's not one individual, it's a partnership, it's collaboration. What you see here in front of us is that. What you see here, standing here, is that. Josh, on behalf of the people of Bergen County, on behalf of this hospital, I thank you for your commitment to the people of Bergen County, to the 5th Congressional District, but most of all, for taking care of those people. Thank you so much.
Thanks, Jimmy. Thank you. Well, it's not easy to follow Jimmy. I know, so, that's why you went before him. So thank you very much, County Executive, for your phenomenal leadership, and to the commission, right? I mean, really, our 2 commissioners here with the team that you drive every single day and what you all do. Tommy and Mary, thank you. And I'll tell you this, so I was talking to Jimmy before, I said, yes, this wouldn't exist without our county executive, without our commissioners who put in so much. I said, I'm thinking a little naming rights here. It could be Jimmy, Tommy, Mary on the door if you want, on the, What's wrong with that on the emergency room? I'm just thinking out loud here. I'm honored to be here with Deb because I'll tell you, and I know the county executive feels the same way, throughout the pandemic, I don't care when it was, what time of day, what we were facing on that given hour, Deb Visconti and every single doctor, nurse, EMT, tech, anyone involved with this institution was on the phone, here in person, ready to work, ready to help people, ready to serve people. Frontline healthcare, you called them heroes, it's exactly what they are. Heroes put their lives in the line to protect our community as they do every single day. And to all of you, I can't tell you enough just how grateful we all are for you. Thank you. And I know it's true what Jimmy said, this wouldn't have existed without his foresight. And I'll tell you, you come here and you realize and you talk to people about how lucky they are when they're cared for here, and how well they're treated, and how kind people are, and how they're looked out for. You don't get that, by the way, at every single place you go to, right? Yep. But every time you show up here, that's the feedback I get, and that I know doesn't happen by accident. We're here today at Newbridge Medical Center in Paramus to announce a great win for the families of Northern New Jersey. Working closely with local leaders here and the healthcare community, we fought for and have officially clawed back from Washington to Bergen County $2 million in new federal investment for the hospital behavioral health emergency expansion project. This critical investment is big news. The sun came out, it's shining, there's a reason. Because this critical investment, as Tommy and Mary also said, will help Newbridge Medical Center expand their emergency department, including more than doubling the number of beds, improving the environment for younger patients, and increasing dedicated space to address mental health and substance abuse for Newbridge patients. This means the hospital will be able to increase care and access to care for patients, expand the clinical team's capabilities, and help Newbridge deliver the highest standard of behavioral health care to our community. We know that Northern New Jersey communities have faced very rough times these last years, causing so many of our friends and neighbors to struggle. Unfortunately, as I'm sure many of you have read, the pandemic only exacerbated an existing behavioral and mental health crisis, including a significant spike in drug use. Yes, our country and state are in the midst of an additional pandemic, one that isn't solved with a vaccine. Although, knock on wood, we're coming out of COVID-19, the other side of it, the pandemic resulted in increased anxiety, depression, behavioral challenges, and substance abuse and use, exacerbating an existing mental health crisis. And unfortunately, as I've heard from so many doctors and care providers, including here at Newbridge, we've seen a significant spike in youth mental health cases, including increased youth emergency room visits related to mental health and a rise in student suicides in school districts across our country. I think as parents, we've all read these stories time and again. Right? I know I've been on the phone with our doctors, our nurses, with Jimmy, with Tom and Mary, our phenomenal commissioners, and we talk about this, of just how our communities are being torn apart by the mental health crisis, by the substance abuse crisis, and that we need to act. You're acting. And that is why we are so proud to be part of what you do every single day. Because during the pandemic, the CDC reported a rise in mental health emergency room visits by 24%, and 31% in children 5 to 11 years and 12 to 17-year-old, respectively. And according to a recent study by the Department of Health and Human Services, the number of American children aged 3 to 17 diagnosed with anxiety grew by 29% over the last years, and the number of kids diagnosed with depression in the same group increased by 27%. Think about that. How many kids and grandkids are affected? According to current estimates, 1 in 5 people, including more than 1 million people in New Jersey, have been diagnosed with mental illness. Deaths from drug overdose have increased in our state from 16.7% per 100,000 in 2015 to 32 per 100,000 in 2020, doubled. Suicides among Americans 10 to 24 increased 47% nationally, including 39% here in New Jersey. New Jersey's Children's System of Care received a record high 14,698 calls this February, the highest call volume it has ever received. These aren't just numbers, these are our kids. And our kids need help. That's why we're lucky to have Newbridge. We need to ensure that we have enough hospital beds, doctors, and nurses to handle this new crisis. We can't allow the crisis to worsen without help. We can't have emergency rooms and hospitals turning away young people looking for assistance, as they've had to far too often during the pandemic, because there just aren't enough doctors and enough beds. We've all heard these stories. I don't care what hospital in Bergen County you talk to on the area, they all say the same thing. We just can't handle the crisis. Give us help. Well, help is on the way. That's why we're here. With cases on the rise, we need to ensure that hospitals like Newbridge across New Jersey have frontline healthcare workers they need, have the resources they need to battle surging mental health crisis and drug crisis. Today, with these resources we're clawing back from Washington, adding to what our county executive and our commissioners have already done, Newbridge will be able to treat members of our community with even higher quality behavioral health services. Our frontline healthcare workers always have our backs, and now we need to have their backs even more when they need it most. We have to ensure that we give them the federal and local investment they need. This $2 million will help Newbridge's emergency department expand, as Deb said, from 19 beds to 49 beds, with 30 dedicated beds to address mental health and substance abuse, with a special focus on pediatric care, right? A special focus on pediatric care. The behavioral health emergency department expansion project will include updated stations, as Deb said, with this cutting-edge living room concept to make younger people feel welcome when they get here, because it's tough to come into an emergency room department. The expansion will include a redesign of nurse stations and medication safety zones, consulting rooms and support spaces, and new staff. 50 new clinical team staff members, not to mention all the construction jobs that will help build it. If you didn't know this, Tom Sullivan also is president of the Bergen County Building Trades, and every day the hardworking men and women of labor help build our facility like this one. And as you can see, the expansion has already started, and I'm very proud to have worked with our county executive and our commissioners to make it possible, listening to them and listening to our local leaders about what they need, building on the vision that they laid out years ago when some people wanted to close this facility down, when they stood up and said, no, we've got to take care of people and make sure that everyone is taken care of. And I would be remiss if I didn't highlight a few other projects that we were able to claw resources back, like this community project, a total of more than $8.5 million across our district. In addition, in Newbridge, we were able to invest in Bergen County's Hackensack Transit Corridor project, a new state-of-the-art CT scanner for Hackensack University Medical Center, water treatment facilities in Ridgewood Water, and Behavioral Health Care Center at Newton Medical Center in Sussex County, improvements for water in Paramus and Saddle River, and Sussex Borough Water Utility. All these things, including the Sussex County Elderly, Veterans, and Employment Service Transportation Services. All these big wins for our community, for our seniors, for our families, for residents with disabilities and our veterans. All things to help people. Jimmy said it best. Government works when what, Jimmy? When it helps others. right? And that's exactly right. We're up 112% since I got to office and what we've clawed back from Washington, because it's time we fight for us. And we know right here, if you go to the tent in the back, right, that I think the commissioners and Jimmy built with their hands and the Army Corps, right? Literally, this was built in the height of the pandemic to help people when we had too many people needing help with COVID. And then it was transitioned to making sure the vaccines got out, right? And we've visited here many times, day and night. Our doctors, nurses, techs in that tent, under that tent, in that facility, helping people during the pandemic and with vaccines and healthcare. And that's exactly the kind of response you want from your government, working and fighting for you and making sure you claw back resources to fight. That's the CARES Act allowed us to do it, a 30-bed facility, a 100-bed medical tent, all done thanks to the leadership here. And we were able to do it in Bergen County with $53 million for the 5th District to make sure we got resources back. Now let's look forward. You got a facility like this one looking forward. We got to make sure we deal with healthcare and mental health stockpiling accountability act to make sure that we have in place the reserves we need. God forbid we're hit again. The supplies we need, the masks we need, the ventilators we need, thinking ahead on what we need for mental health and making sure our doctors and nurses and techs have what they need, and doing everything we can to help the federal government help our county to make sure we lift as many of those costs off our local taxpayers, claw those dollars back, make life more affordable for people in the 5th District, get our taxes down, and deliver for our families. So I just want to say thank you again to our commissioners, to Deb, to our county executive, to our phenomenal doctors, nurses, techs, the team here who does an incredible job. I know if we all stick together, work together, remember that there's nothing partisan about helping our families, right? That is an American issue. If we do it, our best days will always be ahead of us here in the greatest country in the world. God bless and thank you. Thanks, guys. Thanks, County Executive.